Hello everyone, today we are going to learn about the glucose transporter. There are two kind of glucose transporters like SGLT, that are the sodium glucose transporter, and these are the GLUT. Now main difference between the SGLT and GLUT is that the SGLT are unidirectional, means they pass glucose only in one direction. They use the sodium as a gradient. They use sodium gradient and they are unidirectional, and these are the secondary active transport. Okay, these are the secondary active transporter. While the GLUT has a facilitated diffusion, it does not use the sodium gradient, it is a facilitated diffusion. Here is a use sodium gradient, here is passive transport, here is secondary active transport, and it is unidirectional, it is a bidirectional. Now there are two kind of SGLT like SGLT1 and SGLT2. SGLT1 receptors are present in the small intestine. SGLT2 receptors are present in the kidney, which are responsible for the glucose transport. In the GLUT is very important. We have 1 to 5 groups like GLUT1, GLUT2, GLUT1, GLUT3. This GLUT1 and GLUT3 are present in the KBP, that is कौन बनेगा करोड़पति, like K for kidney, B for brain, and P for placenta. These 1 and 3 are responsible for the basal glucose uptake, that is your KBP. Now GLUT2 is present on the lip. Lip means what? L for liver, I for small intestine, and P for pancreas. And that's why this GLUT2 are responsible for the glucose uptake in the failed stage, because lip, that is mouth, and failed stage, we eat through the mouth, through the lip, that why these are responsible for the glucose uptake in the failed stage. Now GLUT4 has insulin affinity, like that the GLUT4 has insulin affinity means what? GLUT4 has means what? H for present on the heart, A for adipose tissue, S for skeletal muscle. GLUT4 is present on the heart, adipose tissue, and skeletal muscle, and it is responsible for the insulin stimulation glucose uptake. Whatever the glucose uptake is stimulated by insulin, that's why. So remember, for your remembering purpose, I have created mnemonic like 4 has insulin affinity, means that when we take the insulin for diabetes mellitus, 4, that is 4 has insulin affinity, that is your GLUT4 receptor. Now we have seen that the basal glucose uptake is done by your kidney, brain, placenta. In the failed stage, your liver is taking extra glucose, your pancreas is taking extra glucose. But if naturally, if glucose level is not controlled in your body, then you have to take the insulin, right? Now this insulin, what is that? It decreases the blood glucose level and it increases the glucose level in the heart, adipose tissue, and skeletal muscle. That's why the diabetes mellitus patients have heart problem, as extra glucose is depositing in the heart. Therefore diabetes mellitus patients are usually obese, because whatever the extra is depositing in the adipose tissue and skeletal muscle. That's why your diabetes mellitus is very dangerous. It is not like that insulin is very good. So it is very important to prevent the diabetes than to cure, because this insulin, it decreases the glucose uptake, it controls your blood sugar level, but it increases the sugar in your heart and adipose tissue, which is responsible for your mainly heart problem and obesity problem. That's why I will suggest just to prevent the sugar, that is prevent the diabetes, than to cure the diabetes. And last one is your GLUT5. Okay, this GLUT5 is present or in the sister like small intestine and sperms, and this is responsible for the fructose transport. Now to remember all this glucose transporter, I have created the mnemonic like एस गया KBP में लिप से हंसकर सिस्टर को चॉकलेट दिया. अब ये क्या है? एस के मीन्स हॉट, दिस योर SGLT1 and SGLT2. S for small intestine, K for kidney. This is your SK. KBP is what? Kidney brain placenta. That is your 1 and 3 basal glucose uptake. LIP, that is your liver, intestine and pancreas, responsible for the fed stage because खाते हैं लिप से ही. Now Husker, Hus means has means what? Your heart, adipose tissue and skeletal muscles. These are insulin dependent because I have told you already the insulin 4 has insulin affinity, that is your 4 has insulin affinity. Sister means what? SIS, your small intestine and sperms. And chocolate, there chocolate contain what? Fructose, that's why your sister, that is your fructose transporter. So this is about the glucose transporter. I have created this mnemonic. Remember this, stick this on your wall and you will never forget about the glucose transporter. Many questions are asked on the glucose transporter, like insulin dependent glucose uptake is done by which, like in the fed stage, which is responsible for the fructose transport, which is present in the kidney, which of the following is not present in the kidney, this is also present, this is also present, this is also present. Like these questions are asked. So remember, it is very important.